YouTube, here is the bag that I use for my daughter's suction machine. I actually have two of these bags, different prints. I bought them, very well loved. They've got some scuffs, some marks. The bottle pockets are stretched out. They're definitely not brand new condition bags, but for using it for a suction machine, I would not want to spend $130 on a bag. But I did want something a little different than the gray bags that they come in. I got kind of sick of those. So this was a good alternative. This is by JuJuBe, and the model of this bag is the BFF. And it is a diaper bag, but it fits the suction unit really well. It's got lots and lots of pockets, lots of organization. The inside is made from is an antimicrobial lining, so it's supposed to help keep the bugs down. So I'll just go through and show you what I keep in here. I think I said I have two of these, exact same setup. One stays in the house, one stays on my daughter's medical stroller. We have a vent tray on the bottom of it that holds her suction unit. And periodically I'll switch them out, you know, change out the tubings and the canisters and charge them and switch the bags, but no specific rhyme or reason to when or why. We only do oral suctioning. She does not have a trach, so she doesn't require all the time suctioning, and then but she's an aspirator and she vomits a lot, so we try to keep her oral airway clear so that we don't end up in the ICU, which unfortunately is kind of her MO recently. We do not deep suction her because she vaguels, so that is not something that we do. So without further ado, here we go. This front pocket is what in most videos is known as the mommy pocket, and I keep oxygen supplies in here. I keep a tank with a regulator set up in the car. She's only on it as needed, so I carry extra supplies with me because it's always that one time that you need to use it that you haven't used it in so long you can't find a dang cannula or anything of that nature. I also keep some of her nebulized meds in her bag because it never fails when we get admitted to the hospital. It takes the pharmacy forever and a day to get her airway meds sent up, so if she's struggling and they want to get them in right away, I do keep a few extra, both in here and in my purse and in the hospital bag. In this pocket there is a sunglass holder. I don't put anything in there. In this first pocket right here, I keep some normal saline bullets. They're good for irrigating the catheter. They're really good for like if you wear contacts, for eye drops. Millions of uses. You can never have too many saline bullets. I also keep 7% sodium chloride. This is what she gets nebulized twice a day when she's healthy, up to, I think we've done it as frequently as every 3 hours when she's really sick and having some issues with secretions. I also keep a saline flush-in. Saline irrigating catheters, saline never hurts to have around, so I just throw one in here. A 1-inch Rollicoban, a pediatric cannula, and then one of these cool Neo Pulse Neo grips. It's Velcro. You can use it to, you can secure tubes in here and clip it to her or her stroller or whatever you need to keep the line to, so that things aren't falling everywhere. And then in this back pocket, I keep 2 sets of tender grips. She's getting old enough that she likes the cannula kind of over her ears and then under her chin most of the time, but our hospital doesn't carry tender grips, and when she's on high flow, the cannula is just too bulky to stay without some support, and these tend to be better for her skin than tape. So that's what I keep in the mommy pocket. There's this felt-lined cell phone pocket right here. It's pretty deep. I can stick my hand in there, but I don't keep anything in there. On this side, I keep a spacer with albuterol and then her flow vent. The albuterol is a rescue med, and we do it before her hypertonic treatments. The flow vent, same reason I listed for keeping the saline, is mostly because the pharmacy can be really, really slow sometimes. I kid you not, we've waited half a day for the pharmacy to send up an inhaler. On the other side, I keep her Acapella. This is a positive expiratory pressure airway clearance device. She blows into it. you can adjust the pressure, and it helps vibrate the airways and helps loosen mucus. She's at an age where her willingness to do it is there when she doesn't need to because it's a fun toy, but when she actually needs to get gunk out, she wants nothing to do with this. So we keep it around, we let her play with it. If she will use it when she needs it, great. If not, then oh well. I also keep a manual chest percussion cup in here because obviously I don't tote her vest around with us every day. In the back pocket are, this bag comes with hooks for a messenger strap. I don't have a messenger strap for this bag, but I do for the one in the car, which I have run around with suction on my hip so that she can play, and when she has to puke, she'll stop and look at me and kind of puff her cheeks out, and I'll turn the suction on and put the yunker right in her, kind of in the opening of her mouth. She'll puke in my hand for me. But this one does have backpack straps, which I've just tucked in here. They clip down here. I don't really see a time that I'd ever wear suction on my back, so I just don't want to lose them. I also keep an extra tubing with a yunker catheter in here. I like the yunkers from the hospital because they don't have the valve you have to cover to make suction. The ones we get from our DME do, so I tend to snag the hospital ones and just clean them really well and sanitize them and use them until I can't use them anymore. Alright, you guys are lucky I just cleaned the suction canister and put new stuff in so you don't have to see nasty suction contents. Although I'm sure if you have a kid who uses suction, that's nothing unusual for you. So the bag opens like this. It's got some gussets on the side that keep it from flopping everywhere. It's got these two brag pockets. They're supposed to be for like pictures. On this side I keep nail polish remover pads. She's 4 and loves nail polish, but as we all know, sometimes trying to get a pulse ox reading through a nail that has nail polish on it is not always most effective. So I keep those on me. And then I also keep an extra probe for her pulse ox, which we usually don't carry with us, but if she's having a bad day or if she's not, hasn't kind of been acting herself, I'll go ahead and throw it in the car with us when we go somewhere. Here's how the suction machine fits in. It fits beautifully. In her stroller, I usually leave it like this, and I run the tubing up and clip it to her right by where her head is, and then I can reach down and get to the flip it on with just, not even looking. So it fits in beautifully. I'm sure you all know, but in case you're a new parent to suction, if you put some mouthwash in the bottom of your suction canister, it keeps it from smelling nasty. Best tip for suction I ever learned, and was so grateful to learn it. Inside of the bag has lots of organization, lots of pockets. On this side I keep the charger for the suction machine. In this pocket I don't have anything. In the back pocket behind it is the car charger, which I don't think I've ever used. This pocket's also empty, as is this one. And then on this side I have extra suction catheters. Our DME can't get us the mushrooms, so I steal them from the hospital and then sanitize them and keep them in the bags. An extra yunker and 2 different sizes of the little suckers, the little sucker and the Neo sucker. And then this one called the Snorkel from Neotech. I don't really like it. I used it I think once for oral suction, and everything kind of flowed back out as soon as I turned the machine off, and it was pretty gross actually. And then I also have there's this pocket right here, this zipper pocket, but I don't have anything in. So if you have a kid who is, trach and you're carrying sleeve suction catheters, or you have to carry more meds, or, this bag has a lot of room to fit other things, but I find it's kind of the perfect suction / quick little airway bag. This nice grab handle at the top makes it really easy. If she starts puking out in her bedroom and suctions out in the living room, my 5-year-old will run out and just grab it by the carry handle and run it into me real quick. And it looks a little bit cuter, but that's not important. That's just something that I like when I'm dealing with medical stuff all day long. Help a little bit. So I hope that was helpful for you guys, and just a nice little change up from our gray suction bags.